Dr. Swati Kanakia, Paediatric Haematologist and Oncologist from Lilavati Hospital and Research Center, Mumbai. Cancer. The word evokes dread. The diagnosis evokes images of pain, needles, hospital visits, chemotherapy, radiotherapy, nausea, vomiting, and hair loss, financial bills, hospital visits, and you name everything. Everything that is unpleasant. And when this diagnosis is made in children, it is even worse. So 15th of February is celebrated as the International Childhood Cancer Day. This creates awareness regarding the disease and its problems in children. We all know that under ideal situations or in ideal conditions, the cure rates of pediatric cancers are around 80%. So what are those ideal conditions? First and foremost is that you have to suspect the disease. How do you suspect the disease? What are the signs and symptoms? So when the child has fever, the child looks pale, is irritable, has bluish spots on the body, has small lumps or the lymph nodes which come up, or the child has liver, spleen, or has any mass anywhere in the body. These are the signs and the symptoms of something which is not good. So you should go to the doctor immediately. The second most important thing is an early diagnosis. So when you go to the doctor will diagnose your disease, and once the diagnosis is made, you have to take the child to a tertiary care center which will look after the management of the illness as well as all the side effects. At that time, don't think that this disease will go away with some home remedies, or that don't be in denial and say that the child will not be able to tolerate chemotherapy. How will he manage the side effects of chemotherapy? Don't worry about all those things. We have enough medications and we can look after all that. After you have achieved a cure, the next important thing is to have a long-term follow-up. That means keep visiting the doctor and make sure that the disease is not coming back. And after all that, there is planning for survivorship. These children are young and they have a whole lifetime of 60, 70 years ahead of them. So you want to make sure that they are contributory members to society, that they are able to make their own living and they are not dependent on anyone. So planning for survivorship is a very important aspect of care. And then unfortunately, if there are some cancers which cannot be treated, in those conditions, we have to ensure that we plan for palliative care, which can give a pain-free end to the child. The next pillar that is being recognized now, and that brings me to the theme of this year's ICCD, and that is better survival through their hands. Through their hands means the hands of the parents, the family, or the caregivers. The diagnosis of cancer is not just for the child. It is for the entire family. They undergo stress. They undergo through a lot of problems. Financial, emotional, social problems, and these aspects is what we are planning to address, or we want to address, which we've already been doing all this time, but the focus this time is on these parents and the family members who need as much help as the child themselves, because we know that better survival can be achieved if the parents and the carers are in their best of health as well. Friends, thank you very much for watching this video. We are trying to do our bit to create awareness about childhood cancers, and I think we just got one step ahead towards Cure All, which is the WHO initiative for childhood cancers. They want that all children should be cured by the year 2030. Thank you so much.